So tell me why you're here today.
So I'm here today because I feel like I'm not having the sensation that I used to have when I used to have sexual intercourse, and I am feeling that I'm more dry. So it's not a big problem yet, but I do feel like it's progressing because I'm thinking about, like, when we go on trips, taking lubricant, I'm having to use lubricant more.
Okay. And you'd had a treatment before, have you?
Yes, I have had a treatment.
So this is your second treatment?
This is my second treatment.
So tell me how you felt after your first treatment of platelet plasma for sexual rejuvenation.
So I did feel amazing, so it definitely made a difference. I felt like I was in my 20s again. The sensitivity was a lot more heightened, which I think I had forgotten that it could even be that heightened, because in your 20s you sort of think that it's you being nervous and you being inexperienced, and so you forget and you get used to things. But after having the treatment, I realized that that's how it should be.
Oh, well, that's amazing.
Yeah,
that's amazing. Okay. So prior to coming to see me, obviously you came and we had a discussion about the different options, and you opted for PRP for sexual rejuvenation. What have you tried prior to coming to me? I mean, you mentioned the lubricant. Did you try anything else at all?
So just the lubricant. I have been to see a specialist, my GP, in regards to hormone therapy. So I was still thinking that over. But she had mentioned, when I went to the GP, she had mentioned these treatments that I could do prior to doing hormones if I wanted to try that for some of the sexual dysfunction.
Okay, so really you felt that you wanted to go down a non-hormonal route first.
Yes.
Try that to see if that could help your dryness and enhance your sexual sort of stimulation. So tell us a little about the process of PRP you experienced when you came in for your treatment last time. How did you feel about the treatment, the procedure itself?
So the procedure was a lot more easier than what I ever anticipated. I do get work done on my face, so I do get Botox and fillers. So I was comparing it to that, and compared to having fillers in certain places of my face, it was so easy. There was some discomfort when we were working in the lips at the back, where the entrance of the vagina is, but when we injected the G-spot, it was really easy, and around the clitoris was so much easier than what I ever anticipated.
Okay, amazing. So you would recommend others to have this treatment, not to be worried about the pain?
Yeah, not to be worried, not to be scared, because you think the area is going to be a lot more sensitive because of other procedures that we may have, like pap smears and things to do with pregnancy. But in reality, it's probably the easiest procedure you'll ever have.
Amazing. In terms of downtime, did you feel you had any downtime? Like, do you feel you could go back to what you wanted to do quite quickly?
Yes, there was no problem. I could feel like some swelling, some minor puffiness, sort of like that puffiness that you have after any treatment, or maybe after sexual intercourse, if it's but then of course it wasn't as much as that, so you could feel something, but it was nothing that stopped you from going about your shopping or going to my other appointments. So
great. What would you say to women out there who are still sort of not confident enough and feel it's a taboo? What's your message to all these women out there?
I would say definitely come in, read the forums, send emails in, maybe go to Instagram or social media to ask questions with yourself, because there's a lot of information out there, and then they can always come in for a consult and discuss, because obviously it is a private treatment and it can really, really benefit. I feel like a lot of women talk to their friends about it. I sort of feel...
Okay. And in terms of PRP itself, I think when you came, I explored the different option, but you were quite certain in terms of you wanted PRP. So where did you get information about PRP? Where did you read up on it?
So I'd done some facial PRP before, microneedling, so I always saw amazing benefits of
plasma,
acne scarring and textural issues. So I was very much wanting PRP because it's from your own body, you're pulling your own blood out. So I really wanted the rejuvenation from the PRP and to explore that route to see what was possible.
Why do you think PRP is important? Why do you think it's important to raise awareness for PRP for sexual rejuvenation?
So I think I was thinking about this intensely, and so when men, because I saw such good benefits, when men have dysfunction and Viagra came out, it exploded, and men were very open. It's sold over the counter now. But women are made to feel like they have to be shy about it, like they can't discuss it, that it's a fault of theirs and it's not part of the normal aging process. So the PRP is like the woman's Viagra. It's like our solution to Viagra.
Yeah, I think I would probably agree with that. And I think it's great that patients like yourself are happy to discuss the benefits and sort of bringing more women forward and sort of breaking that stigma and taboo that's around it.
Yeah.
Okay, so thank you. Right, Roxanne, do you want to come in? I think the plasma is ready. So if you get yourself on the bed, and then you'll have to basically take your shoes, bottom bit off. I'll come back, and then when you're ready, we're gonna cover you up and start the treatment.
Okay.
Is that all right? Okay, we'll give you a few seconds.
Okay.
Okay. So for the next 10 days, avoid any sort of intimacy. Try to wear sort of loose undergarments, give as much air as you can to the area. Drink plenty of water. Obviously the risks are that you could get an infection. And then I will see you again in 4 weeks for a review. Hopefully the last treatment.
Okay.